Hi, Tyrone Carr. Today we're going to talk about the foundations of Medicare Part A and Part B, but also the big misconceptions that I've experienced and I hear on a day-to-day basis that pertain to, is a Medicare Advantage policy a supplemental insurance? What's a supplemental insurance? But then also my Part A deductible. I hear it every single day. These misconceptions, and unfortunately so many people go throughout their years of being in Medicare not even realizing still the financial exposures that they have, and that if anything were to happen that they could pay a lot of money out of their pocket. So I wanted to create this presentation to help educate people so they can make the best informed decision and having confidence in those decisions, but hopefully you'll have confidence in us at Tyrone Carr & Associates to help give you the guidance you need as far as moving into those golden years. So, but before we begin, I'd like to share with you just an example of a story. You hear from, I've heard from people, I've been on Medicare, or I'm in the process of going on Medicare, and I went to a Blue Cross Blue Shield seminar, another company seminar, and I've learned a lot of great information. But even still, they still have a lot of misconceptions as to what they can or can't do, or what's covered or what's not covered. And give you an example. A Medicare Advantage is not a supplemental insurance, which we'll talk about today. Two entirely different types of policies. And as a car guy, I would say that it would be like comparing a pickup truck to a sports car. Two different types of vehicles that fulfill two different types of purposes or means. So first of all, for example, when someone enrolls into a Medicare Advantage, they assume naturally that they can just, if they don't like it, they can try it, test drive it, and if they don't like it, they can switch over to a supplemental insurance. That's not the case. And we're going to talk about that and why it's so important that when you're aging a Medicare Part A and Part B, that you make the best decision for you and you only. And we're going to help you today to understand what Medicare Part A and Part B covers and all those misconceptions, so that way you can have confidence ultimately in your decision as far as moving forward. So let's get right to it. So first of all, we're going to start with Medicare Part A. Okay? Medicare Part A covers the hospital. Now, the first misconception about your Part A deductible, which is for this year $1,288, is that's calendar year, January 1 to December 31st. Folks, it's not. It's actually per benefit period. Benefit period, well, what's a benefit period, right? Well, benefit period starts over every 60 days. So it's 12 months in a calendar year, right? So if we take that and divide that by the number of months in a calendar year, that's 6 times per year that you, as the individual that's going on Medicare Part A and Part B, are at risk of paying that financial dollar amount of $1,288. That's over $7,600 on any calendar year, given calendar year, that you could potentially pay that. You need to understand what your deductibles are. In my close to 12 years of being in the business, the industry, I've only had one person, and I'm not exaggerating the number, that actually was aware of that their benefit period started over every 60 days. Now, day 61 through 90, you have a financial obligation of $322 per day that you are responsible for. On day 91 and beyond, you have 60 lifetime reserve days total. And that dollar amount is $644 each day for those 60 lifetime reserve days. After that 60 days of lifetime reserve, you are responsible for 100% of the cost. Okay? Now, in addition to that, your first 3 pints of blood are not covered by Medicare. You, the individual that's on Medicare, you are responsible for the first 3 pints of blood. That cost can range between $200 to $1,200 per pint. And ultimately what decides with the cost is the rarity of your blood. So naturally, the rarer your blood is, the greater the cost is going to be to you, okay? Now, once you go on Medicare Part A, there's no cost associated other than your deductibles, your co-insurance, your blood. Now, as long as you've accumulated 40 quarters within inside of your lifetime, which would equate to 10 years, doesn't have to be consecutive, Part A comes to you at no cost other than the obvious here, okay? Now, in addition to that, the second part to Medicare is Part B. This covers the medical. So when you think of medical, you'll think of people. So when you enter into, you go to visit your primary care physician or your specialist, whether you're there for a scheduled visit or, as a result of, emergency room visit or urgent care, or anything like any medications are administered during a hospital stay or an office visit are all going to fall under Part B. Now, any medications that are administered outside of the hospital or doctor's office, meaning that you administer them themselves, it's a medication that's prescribed and refilled at a pharmacy, that falls underneath the Part D drug plan, which we'll get to here shortly. But anything that's administered through a doctor's office or a hospital is going to all fall under Part B. Now, Part B has a deductible which is $166, and this is per year. Now, after you've met your $166 calendar year deductible, Medicare is an 80-20 coinsurance. Give you an example. If you entered into the hospital as a result of a stroke, a heart attack, cancer, or a broken bone, or something of that nature, and you've accumulated services that were rendered of $10,000, you first would have to meet your deductible. Once you've met that deductible, Medicare will pay 80% of the Medicare approved amount. You would then be relieved with the 20%, which would equate to $2,000, just a simple example. Now, unlike Part A, where there's no cost associated with it, Medicare Part B there is. Once you go on Medicare, Medicare goes into effect the first day of the month in which most people are taking Medicare Part A and Part B when they're turning 65. Rarely do you see people deferring to a later time and date, but that's an option. Now, for just simplicity purposes, today, let's assume you're turning 65 in August and your birthday falls on August 31st. Medicare Part A and Part B is going to take effect on August 1st. At that point, Medicare then becomes the primary. Now, for those that are already receiving their Social Security check before Medicare Part A and Part B goes into force, the Social Security's office is going to enroll you into Medicare Part A and Part B, so you're not going to be required to contact them and to enroll. It's only those that are actively not receiving a Social Security check and are not beginning their Social Security check until the month in which their Medicare Part A and Part B is going into force. Now, at that time, Medicare will deduct $121.90 from your Social Security check if you're beginning your Social Security check here in the year of 2016. For those that were already receiving a Social Security check, this would actually be $104.90. Okay? Now, at that point, Medicare becomes the primary. Now, the federal and state laws require that all hospitals are required to accept original Medicare Part A and Part B. So you're not restricted or limited to a certain specific network of doctors and hospitals because they have to. It's a federal and state law. Okay? Now, the exposures in which we have within inside of Medicare, or the misconceptions, is that we still have deductibles that we have to address. We have to address the co-insurance, the co-pays for the doctors, co-pays for medications. Now, typically I like to start out with talking about a Medicare supplemental insurance, but because there's such a high misconception that a Medicare Advantage is a supplemental insurance, I'm going to kind of go off track a little bit and talk about that first and foremost. Because I want you to understand that a Medicare Advantage is not a supplemental insurance. There are two entirely different types of policies. So a Medicare Advantage, which is also identified or known as Part C. So if you ever hear the term Advantage or Part C, understand that it's the exact same type of policy. Now, unlike a Medicare supplemental insurance, which is designed to coordinate benefits with Medicare Part A and Part B, Medicare Advantage operates entirely on its own. So a Medicare Advantage is actually acting as both the primary, but also as the secondary. So I want to talk about all the specific misconceptions with the Medicare Advantage, which, number one, it's not a Medicare supplemental insurance. We've pointed that out. Number two, one of the other misconceptions with the Medicare Advantage is, if I enroll into this, is my Medicare, original Medicare, still active? It's actually not. So let me start by giving you a brief history lesson into how Medicare Advantage was introduced to the marketplace, the time and date, but then also kind of the behind the scenes, because I think it'll help you kind of understand everything. So back in the early 2000s, the insurance companies came up with the idea of a Medicare Advantage, and they approached Congress. Now, there was really two motivating factors in them doing this. Number one, they were of the opinion that, which is actually true, they've actually been around longer than original Medicare. Original Medicare has only been around since 1965. We've had insurance companies that are well beyond 1965. So now with that, they felt that they could provide or created an insurance policy plan that could operate more efficiently and effectively. Now, whether that's true or not, that's a whole other conversation. But the second motivating factor is what the insurance companies learned about Medicare and how much they fund the Medicare program. So what we know is that when you have someone who's turning 65, use the example of coming August, that individual who's aging into Medicare for the very first time come August 1st, Medicare is this Medicare fund. So at that time, Medicare will put $1,200 into the Medicare fund. So all those that are already on Medicare, the government's putting $1,200 into that Medicare fund. Now, the reason for that is when you go to make a claim against Medicare, they take money out of that fund to pay for 80% of their financial obligation or responsibility. Okay? So the insurance companies learned or became aware of this fund and said they saw this as an opportunity. Now, so what they did is when they approached Congress in the early 2000s about the Medicare Advantage policy, they said, well, you know, Mr. Government, if we take over kind of, you know, the basic benefits of Medicare Part A and Part B, we incorporate some other health care coverage, some drug coverage, so meaning that you guys give up the responsibility, we take it over, that you would compensate us out of that $1,200. Now, the true definition would be a subsidy. So what they recommended is that if the government pays them $950 per month out of that $1,200, the government keeps the remaining $250, passes go, throws their feet up on the desk, cross their arms, relax a little bit. The insurance company takes on all the responsibility at that point. Now, so the government said, okay, as long as your basic benefits are equal to Medicare Part A and Part B, we're okay. So underneath the Bush administration, they passed the law in 2003, and then effective January 1st of 2006, the Medicare Advantage policy was introduced to the marketplace for the very first time. Now, in order for the insurance company to receive this subsidy from the government, you as the person who's aging in Medicare or considering a Medicare Advantage policy, you're out, you know, going to a Blue Cross Blue Shield seminar or a HAP or Priority Health or some of these other carriers, they're out there. And so you're filling out your application, and this is what the process actually looks like. So you're putting your name, address, phone number, Medicare card information, you know, emergency contact, you know, are you or your spouse on Medicaid? Do you or your spouse work? You know, what is the payment method in which you want to take care of this policy? Do you currently reside in a nursing home or assisted living? and you check the box, those boxes, and then you sign the dotted line. Now that application, once you turn it in, you submit it, the insurance company will review that application to make certain that you filled out all the appropriate boxes and then you've signed the application. Once they see that they have, they then give their check of approval. Once that check of approval is done, they then submit that application over to Medicare for final approval. Now Medicare, just like the insurance company or provider has done, they will review the application to make certain that you filled out that particular application accordingly. Once they see that you have and that you sign on a dotted line, they're then under the impression that you're told by your agent, he or she, whether you met through a seminar or you talked to somebody directly through the carrier, but nonetheless, you were told and informed that you're giving your legal consent to actually disenroll out of original Medicare. So the question you have to ask yourself, did the person you speak to tell you that the Advantage policy that you're enrolling to, that by enrolling in this, that you're going to actually disenroll? By doing that, that's why that policy is identified by a specific network, a PPO, an HMO, or an HMO POS. You need to understand the restrictions between these three different types of networks. Okay? Now, also that comes with the Medicare Advantage, well, you have referrals if it's an HMO. So I'm going to highlight that, not when it comes to an HMO POS or a PPO, but that's one of the restrictions that you're going to place on that type of policy or coverage. You have deductibles. Those deductibles can range from $100 and it be as high as $1,500 per policy, depending on the carrier and the specific plan. You have copays, and those can vary whether it's emergency room, urgent care, a primary care physician or a specialist, or inpatient care. In addition to that, you have what they call max out of pockets. Now, those max out of pockets can range from carrier to plan, but a minimum $3,400, it can be as high as $10,000 per year per plan. Now, what this is completely separate from the actual monthly expense to have that specific plan. But these are some of the exposures. But not just to stop there, just take a step further. Certain cancer facilities do not accept Advantage plans. Just to highlight that. And this is the part where I remind people that the whole premise behind having an insurance policy in place is to protect your financial portfolio or your checking or your savings account. It kind of defeats the purpose if you go to use it and you don't have the appropriate coverage in place, or you think you have the right policy in place and then come to find out you go to use it and it's not what you thought it was. So it's so important to understand that this next chapter, phase in your life, that when you go on Medicare, that you understand the type of policy in which you're getting yourself into and how that's going to affect you and your family from a benefit standpoint. Okay? So in moving forward, I've given you the advantage or the disadvantages to an Advantage policy. So what are those specific disadvantages or advantages to an Advantage policy? This is generally when people are asking me. I don't get it, Tyrone. I don't see it. The advantages to an Advantage, if you want to call them that, I don't particularly think that they are, but to share them with you anyways. Number one is they will highlight, for example, we'll give you a free gym membership to certain participating facilities. Now, if I'm being objective and being honest and unbiased, this is where I would say, but you can go get a gym membership at Planet Fitness for $10 a month, and we're going to offer you a free gym membership, but you're taking on all this exposure, right? The other advantage to the Advantage is, well, we're going to incorporate drug coverage built into it. Well, yeah, but we really don't know what type of drug coverage. I'm just getting what you're giving me. The third benefit is we'll say, well, hey, we'll offer you a free eye exam per year. Well, as an individual who's actually had cataracts, back when I was in high school, I was actually accidentally shot in the eye with a paintball gun, and I actually had a cataract that formed in my eye. I actually had to have 2 surgeries. An eye exam is about $60 a month. So you're taking on a lot of exposure, and I think you'll understand when we kind of get further into this, into my presentation, about some of these misconceptions. And then, the last but not least so-called advantage is we'll incorporate some dental benefits, like 2 free teeth cleanings. Well, understand that this is not dental insurance. It's just it's the cleaning process. This is going to cover an extraction, a root canal, some of the major services. So you have to understand the details of what it comes with the Medicare Advantage and how much or what you're giving up, okay? So this next segment, which we're going to talk about, the supplemental insurance. So you'll see the difference between an advantage and a supplemental insurance. So just again, to make it very clear, an advantage is not a supplement or Medigap. It's something entirely different. They're 2 different types of policies. So what the government did is they created what we know today is called a supplement to Medicare, or another commonly used term is a Medigap. A supplement is actually designed to coordinate benefits with Medicare Part A and Part B. So these 2 here are designed to coexist. Medicare pays first under all circumstances, and a supplemental insurance will pay second based upon the individual plan in which you've chosen to provide you the benefits in which you feel is going to meet your needs or wants. So in speaking to that, the government created 10 specific plans, and each plan is identified by a letter. Now, these plans are standardized, and what that means is that every insurance company across the United States that's in the Medicare business or supplemental insurance business, they can choose up to 6 specific plans in which they want to market the Medicare community. Now, each plan is identical from company to company. So I'll give you an example. We're going to talk about Plan F, just for presentation purposes. Plan F is identical from one company to the next because Medicare standardized them. It's a federal and state law, so they can't change them to manipulate you into doing business with them. So you're getting the exact same coverage with one carrier to the next. So that asks the question, what's the difference then? Well, the difference is premium. So you could talk to one particular carrier and the cost is $30, $40 cheaper per month than it is with another carrier. The other determining factor for a lot of people is customer service. So we want to bring that to your attention. The third variable we'd like to talk about is financial strength and stability. Okay, and then give you kind of a history of what rate increases have been, so kind of moving forward, kind of give you historically kind of what they may look like in the future. Now, we can't guarantee anything, but at least you kind of have an idea of what they have been historically speaking. Now, so what we've mentioned here today, or so far, is that supplemental insurance is designed to work with Medicare Part A and Part B. But for presentation purposes, we're going to talk about Plan F. And the reason why we're going to highlight F today is just establish a foundation. And I'm not making recommendation F or an advantage. I'm just giving you an overview. I want you to just a foundation of what all these cover, don't cover, exposures, pros and cons. But however, Plan F is the #1 choice amongst the Medicare community throughout the United States. For the simple reason, it's the most comprehensive health insurance plan you can get, period. What does that mean when we start talking about the exposures within inside of Medicare, or deductibles, or co-payments, or co-insurance, medications, and all that? So let's put that on paper or on the whiteboard here. #1, assuming you chose Plan F, again, there's 10 plans you can choose from, there's no deductibles. Plan F, as long as you paid your monthly premium, pays for Part A and Part B 100%. Under Plan F, no co-insurance. Covers both Part A and Part B completely. Under Plan F, you have no co-pays. Covers both for primary care physicians, specialists, urgent care, emergency room, labs, x-rays, you go in for, the pap smears, the mammograms, prostate cancer exams, MRIs, CAT scans, EKGs, cataract surgeries, knee replacements, hip replacements, chiropractor, physical, occupational, physical therapy is all covered in Medicare Part A and Part B. What's not, well, in addition to that, again, there's no network. So if you're concerned, first and foremost, with being restricted to, can I continue to participate with my current doctor? As long as they accept original Medicare, they have to. It's a federal and state law. So they can't refuse or accept one particular carrier over another. Again, it's a federal and state law. So you have no networks. And again, that's one aspect I'm going to point out. With the Medicare Advantage, you're always going to be restricted to a network. Here, you're not going to have any limitations with a Medicare supplemental insurance. So just a mental note, just any literature that you receive in the mail, anything that has a network attached to it, that's a Medicare Advantage. A supplemental insurance will never have a designation or be indicated by a specific network. Just a mental note, okay? Now, because there's no network, there's no referrals needed in order to see a specialist, because there's no network. A network referrals only apply to HMOs. Okay. Now, how do we identify a Plan F that's going to have the most competitive price? And the question, or the answer to that question, is zip code. So, as a broker, as an independent, when we go into a specific area of the state, or depending on the state in which we're in, we identify the zip code. The zip code allows us to look at all these specific carriers that operate and do business in that specific area, and then will provide us the specific price based upon that specific plan in which you've chosen. Okay, so we can determine who's got the most competitive price, and then ultimately it's our responsibility to share with you kind of like customer service based upon our experience, and then financial strength and stability, and then historically speaking, where the rate increase has been over the years. So now. So what we've addressed at this point with the Medicare supplemental insurance Plan F, there's no deductibles, there's no co-insurance, and there's no co-pays to the doctors. Now, what a supplemental insurance does not cover is Medicare Part D drug plan, or drugs, I should say. That's a whole separate policy. So moving forward and talking about the Medicare Part D, which is again, our RX coverage. Here in the state of Michigan, you have 50 plans to choose from. Now, depending on the state in which we're doing business, each state has a different number of Part D drug plans in which they offer. And those can vary depending on certain regions inside of that particular state. Also, Medicare Advantage policies. Now, you say to yourself at this point, 50 plans. I don't need 50, I just need one specific plan, right? So how do we identify that one specific plan that's going to meet or identify with my needs? Ultimately, those 5 variables or factors are, number 1, your zip code. The zip code allows us to look at all the pharmacies within a certain mile radius of our home, so we can be very specific. 2, what is the name of each and every medication that I'm taking? So, give you an example. If you're someone who's taking atorvastatin, which is the generic for Lipitor, I want to know that you're taking atorvastatin. Don't tell me you're taking Lipitor, because that can affect the whole formulary and the cost. 3, what is the dosage amount? So is that once, twice, 3, 4 times a day? Number 4, what is the frequency of use? Is that once, twice, 3 per day? And then number 5, what is the frequency of refill? Is it a 30-day refill, 90 days? Now, because certain medications have quantity limits, based upon whether they're narcotics and all that stuff. So you may have to get prior approval. So it's important that we understand the answer to these questions so that way we can make a educated, informed decision or recommendation. So it simply looks like this. We take these variables, factors, we plug them into the drug formulary, and it puts an order from 1 to 50 of which drug plan is going to maximize your coverage and savings for that particular calendar year. And then that's something that we can review on an annual basis to make certain that you're in the right specific program. I'll give you an example where something could, where this could cost you a lot of money. Client, this is about 4 years ago, was forced to retire as a professor from one of the local universities, University of Michigan, due to the beginning stages of onset dementia. And when we enrolled her into the Medicare drug plan, this particular year, the cost of her co-pays for the entire year was going to be about $2,900. Now, when we went to go and actually review the following year, if we hadn't done this and we just left things the way that they were, if she were to stayed in that same drug plan, and it's not to say that she wasn't happy or her husband wasn't happy, because they were, but the coverage within inside of that drug plan was going to change, that her cost was going to increase from $2,900 up to $24,000 out of her pocket. So it was so important that we did that review just to be certain that she was going to have the adequate or the appropriate coverage that it would have been recommended based upon those medications. And nothing changed on her medications. It was just the plan itself had changed its own formulary that were specific to her medication. So it's important that you have this reviewed on an annual basis. So, and we can assist you with that, making certain that you're in the right place, every single year. So now, kind of, taking a step back, in summary here, you have Medicare Part A and Part B. If you have a supplemental insurance, these two policies, or I should say, I don't know what to call it policy, but Medicare and a supplemental insurance are designed to actually coexist. When you go to the doctor, you're going to give them your Medicare card. Now, Medicare is going to be billed for those services that are rendered. Now, Medicare will identify the insurance company you have based upon the Medicare claim number. So they can pull up and say, oh, you got Mutual of Omaha, or you have Blue Cross Blue Shield, or AARP. Once they've approved of those services rendered, they will electronically bill the insurance company behind the scenes. So you don't play any role in taking care of any payments or sending in a check. That's all done electronically behind the scenes. Then you'd have a third policy, which would represent your drug plan. So the beautiful thing about this option, Medicare, supplemental insurance, and drug plan, is that you can be a la carte. So meaning that you could have one particular carrier, like for example, Blue Cross Blue Shield supplemental insurance, and like a Humana or AARP drug plan, or any other combination of carriers, to leverage your savings on any calendar year. With the Medicare Advantage policy, we choose, this is based upon county. So when we go into a specific county, or depending on the state, one county could have 15 options, whereas another county could have 5 options. It just depends on county, as I indicated. Now, in doing so, when you're talking about a MAPD, and MAPD stands for Medicare Advantage Prescription Drug Plan. Now, when you choose a Medicare Advantage Prescription Drug Plan combo all in one, you're just getting whatever drug coverage that comes with it. So it's a lot harder to be as specific when you're talking a Medicare Advantage or Medicare Supplemental Insurance and Drug Plan versus a Medicare Advantage. So at this point, when I put these side by side, the reason why I present them the way that I do is because I want you to understand the pros and cons and the differences and the misconceptions behind a Medicare Advantage and supplemental insurance. Again, they're two completely different types of policies. Your deductibles, I'm certain you didn't think they're as high as what they actually are. Now, none of these policies truly provide you any coverage against a nursing home or assisted living other than hospice and some home care benefits. You have 20 days worth of coverage in a skilled nursing facility. With a Medicare supplemental insurance, you have to be admitted inpatient for 3 consecutive days. But you have to make certain that it's coded properly at the doctor's office where it's not outpatient. If it's considered outpatient, then you're not going to get those 20 days worth of coverage with Medicare and then the additional 80 days with the supplemental insurance, which gives you a grand total of 100 days. Days 101 beyond, you're responsible for 100% of the cost for nursing home or assisted living, with an exception to hospice care. Okay? So, if you'd like to have any further assistance and kind of just be more specific and tailor a program around you, give us a call at Tyrone Carr and Associates. Look us up online. You know, I created this presentation. The reason being is because over the last 11 plus years I've been in the industry, I've seen so many people have made uneducated decisions, and it wasn't any fault of their own, but it was just where they received, you know, certain information, or, you know, they took, you know, something out of context of what somebody may have said. So, you know, that's, you know, our heart is just to really make certain that, you know, whether you choose the supplemental insurance, make certain that you're getting the best program for the most competitive price. Or if it's a Medicare Advantage, make certain that you're getting the best Medicare Advantage based upon what's specific and to your needs, whether it be financial or from healthcare benefits. You know, at our firm, we're not biased to either one of them. You know, our goal is ultimately for you to be educated so you can make the best informed decision, so you have confidence in yourself, but hopefully you have confidence in us and assisting you with that process. So, but a Medicare Advantage has merit. It's not to say that it doesn't. Some people at this point in the presentation will say, well, I want nothing to do with the Medicare Advantage versus a supplemental insurance. Medicare Advantage has merit under the right circumstances. If you're someone, you know, who can't afford a supplemental insurance and this is an only option. And here's the thing that is a big misconception, is that Medicare supplemental insurance are really expensive. You know, your average plan off, you know, is about $160 a month. Some are less. I'm just kind of giving you a roundabout number, but depending on certain areas, they're a lot less. A Medicare Advantage, you know, they have premiums. They're zero premium. They go up to as high as $293 per month. The average PPO is about $130 per month. So when you put them side by side, here you have no out-of-pocket cost. A Medicare Advantage policy, you could still be paying exactly the same amount and still have $4,000 or $5,000 out of pocket. You know, one of the big providers, you know, here in Michigan, Blue Cross Blue Shield, their two most popular plan, the Signature Assure plan, $169 and $294, and it's got a $3,400 max out of pocket. You could get their supplemental insurance for less money than that. It just doesn't make any sense. So we kind of help you kind of sift through all those, you know, just the confusion, the misconceptions, or help bring attention to some of the misconceptions that you may have, or maybe that you've heard. And so ultimately our goal is to help lead you to making the proper, the educated decisions, so that way you have confidence that moving forward. The other part I want to, you know, emphasize as well is that when somebody's turning 65, you have your initial election period. And the initial election period, you know, can be 6 months prior to the effective date of Part A and Part B, depending on the carrier, and then it can be 6 months following. Now, one of the biggest misconceptions, and I've seen, is where, you know, people just assume, hey, I'll try this Medicare Advantage. You know, I'm saving $30, $40 a month versus a supplemental insurance, and I can try it out. If I don't like it, I'll just, you know, jump ship and I'll jump on Medicare supplemental insurance. You can't do that. And a lot of people confuse Obamacare or the annual election period, which is October 15th to December 7th. So I want to make something very clear. October 15th to December 7th, yes, is your annual election period. At that point, you can change from one Medicare Part D drug plan over to another Medicare Part D drug plan. You can change from one Medicare Advantage policy over to a Medicare Advantage policy, unless you have end-stage renal disease. That would be the one health question that would disqualify you from changing from one Medicare Advantage over to another. During that time frame doesn't mean that you can go from an Advantage to a supplemental insurance. You can't do that. You have to medically qualify first. So let's say you've tried this out for, you know, 2.5 years. And I had this, you know, an incident where this a person that I had met, you know, a few years after she had been on Medicare, and somebody had enrolled her into a Medicare Advantage. She actually went to a seminar, and that's how she enrolled. And then she enrolled over the phone. Now, she was told, or at least, or maybe she took it out of context, that, hey, I can switch at any given time. Yes and no. In this case, here she is, she's past the age of 68, and when she entered into an agreement, a contract with the Medicare Advantage, she was healthy. But later on down the road, when she started having health issues, she started realizing that she's got all these co-pays and max out of pockets, and she really wasn't, at times it became overwhelming, and she just got inundated with co-pays here and there. So she learned that, hey, I want to get onto a Medicare supplemental insurance. She was referred to me. So when I sat down with her and I began to kind of do the discovery process, learn a little bit about her situation and what kind of led her to this point, that she had these health issues, and I informed her, I said, although you want to change and increase your benefits, you are going to be responsible for answering these health questions. You know, they ask for, whether you're a smoker or not. So if you're a smoker, they're going to rate you because you're a smoker versus a non-smoker. They're going to rate you based upon your height and weight. And if you answer yes to any of the health questions on the application, they refuse you coverage. So no, you can't just switch from a Medicare Advantage over to a supplemental insurance. That only applies to a Medicare Advantage over to a Medicare Advantage, or a drug plan to a drug plan. Now, a Medicare supplemental insurance, one of their misconceptions is that you can only change this during the annual election period, October 15th to December 7th. That's not the case. You can change a supplemental insurance anytime during the calendar year. That's one of the benefits, the pros to having a supplemental insurance, is because you can change it. So if there are rate increases, you can change during the middle of the year or after the annual election period. There's no restrictions on that. So that is one of the benefits. So you need to understand that at this stage in your life, that the likelihood that you're going to stay healthy for years to come is not a reality, because as you get older, statistics show that people will become unhealthier. And so this is the time when you really want to make certain that you make or have the appropriate coverage in place, so that when the time comes, if you are in need of care, whether it's a result of a stroke, a heart attack, or if you're a diabetic, or have a family history of any other type of health ailments or issues, that you have the appropriate coverage. And so, we're here as a resource, as an advocate, to work on your behalf. We're not biased to any particular carrier, whether it be a Medicare Advantage or supplemental insurance. It's just to make certain that you have the proper information so you can make it an educated, informed decision, and you have confidence not only in yourself, but hopefully you have confidence in us. So please, again, thank you for your time. Thank you for listening. If you would like to speak to someone more on an intimate level, one-on-one basis, whether it's a consult or meet with someone face-to-face, visit us at tcarassociates.com, or give us a call at 810-534-3008. Thank you again for your time.